Hi everyone, my name is Maddie Nance, and my current background as a nurse is in the neonatal intensive care unit. I have worked in the NICU now for about a year and a half. Today, I'm choosing to present on a topic that's outside of my practice and that I don't get to see in my field. Today, I will be presenting on asthma. Asthma is a very prevalent topic in both the adult and pediatric population today. In my presentation, I hope to provide you with valuable information regarding asthma as well as expand on my own knowledge. First and foremost, I will quickly brush over my objectives for my asthma presentation. First, I hope to dive deeper into the pathophysiology of asthma and examine both environmental as well as genetic factors that contribute to the development of this condition. Second, we will dive into the manifestations and symptoms that we will see with a patient who presents with asthma. Next, we will look at pharmacological and non-pharmacological treatment options for how patients can manage their conditions at home. Next, we will look at diagnostic and laboratory testing that can help aid in diagnosis for a patient with asthma. And then lastly, we will look at patient education and teaching for risks, signs and symptoms, treatment options, and better ways that the patient can manage their asthma condition at home. In the article, The Treatment of Mild and Moderate Asthma in Adults, it provides an overview of asthma. It states that asthma is characterized by chronic inflammation in the airways, airway obstruction, and it can be life-threatening without treatment. Overall, the cases of asthma continue to be on the rise. For my next slide, I will be reviewing the pathophysiology of asthma. In the article, Asthma Management, I found that there were 3 distinct factors of the pathophysiology of asthma. The first one was airway inflammation, the second one was intermittent airway obstruction, and the third one was bronchial hyperresponsiveness. First, we will review the first topic, airway inflammation. I dove deeper into our textbook, Applied Pathophysiology for the Advanced Practice Nurse. I found that this airway inflammation is due to an exaggerated immune response. During this exaggerated immune response, the body releases inflammatory mediators. So these are histamine, prostaglandins, and leukotrienes. And this all occurs when a patient is exposed to triggers, allergens, and irritants. Next, we will review intermittent airway obstruction. It's important to remember that this intermittent airway obstruction is reversible with treatment, and the cause of this obstruction is due to airway inflammation and airway edema. Next, we will review bronchial hyperresponsiveness and bronchoconstriction. Throughout our course, we have learned about hypersensitivity reactions. Asthma would be considered a type 1 hypersensitivity reaction. This occurs when a patient is again exposed to allergens, irritants, and triggers, and there is an exaggerated immune response, which causes the bronchial hyperresponsiveness and bronchoconstriction. Lastly, I will quickly review triggers for asthma. So triggers are just another word for allergens and irritants in the environment. These triggers can be things such as pollen, smoke, pet dander, and it can even be exercise-induced. Overall, the pathophysiology of asthma includes airway inflammation, intermittent airway obstruction, bronchial hyperresponsiveness and bronchoconstriction, and triggers in the environment. Next, I will be reviewing the clinical manifestations of asthma based on our textbook, Applied Pathophysiology for the Advanced Practice Nurse. So the symptoms of asthma come in 2 different phases. So the first one will be the early response, or what we consider an asthma attack or an asthma flare-up. So this goes back to our pathophysiology when the patient will have bronchoconstriction and the release of inflammatory mediators, such as histamine and prostaglandins. So during this time, the patient will show symptoms such as wheezing, dyspnea or difficulty breathing, chest tightness, a cough, tachypnea, tachycardia, accessory muscle use, and anxiety. If this is left untreated, it can lead to hypoxemia, which leads into our second phase. So the second phase is the late response, and this involves airway edema and excessive mucus production. So this occurs later after the early response, and this can lead to air trapping, fibrosis, scarring, and irreversible airway damage if left untreated. This picture from Facts on Asthma shows both the early and late responses that we were just discussing. So on the left, it shows the early response, which begins with a trigger and the activation of the exaggerated immune response and the release of inflammatory mediators, which causes bronchoconstriction, inflammation, and increased mucus production. So the patient will show wheezing, shortness of breath, and chest tightness. And then on the right, it'll show the late response where it can eventually lead to airway remodeling and chronic inflammation if left untreated. Here I will discuss the risk factors for asthma. According to the article Asthma Management, I found that the first risk factor for asthma is the family history. Therefore, the article mentioned that some patients can have a genetic predisposition that places the patient at risk for developing asthma. Next, I found that patients who have other allergic conditions such as seasonal allergies and allergic rhinitis are placed at more of a risk for developing asthma. After this, there are also many environmental factors that can place a patient at risk for asthma. For example, patients who work outdoors and are surrounded by smoke and pollution can be at risk. And then patients with seasonal allergies who are allergic to things such as pollen are also at risk. With this, patients who have an overall unhealthy lifestyle, are inactive, and obese are placed more of a risk than others because they have a compromised immune system. Also, after this, I found from our textbook, Applied Pathophysiology for the Advanced Practice Nurse, that age and gender can also play a role in asthma. So, first of all, asthma is more commonly diagnosed in childhood, and boys are more commonly diagnosed than girls in childhood. However, in adulthood, women are more commonly diagnosed than men. After this, I found that patients who have multiple races and ethnicities and African Americans are more at risk for developing asthma. Overall, asthma has both environmental and genetic components that can place a patient at more at risk for developing this condition. In my next slide, I will review the diagnostic and laboratory testing for a patient with asthma. According to the article, Management of Severe Asthma, it mentions spirometry as a diagnostic test for asthma. With this, according to our textbook, Applied Pathophysiology for the Advanced Practice Nurse, it mentions that we can obtain a chest x-ray and pulmonary function tests to get a better idea of lung function. After this, we'll do our laboratory testing, and these would include an arterial blood gas. This also will provide us with a better idea of if the patient is retaining CO2, get a better idea of our oxygenation and just overall gas exchange. In severe cases of asthma, it can lead to hypoxemia. Next, we would get a complete blood count, and we'll look at the white blood cells, rule out any infection, but it can also just give us a better idea of the patient's immune response. After this, we can do allergy testing to rule out any triggers that the patient has and look at any potential causes for the patient's asthma. Our textbook also mentions the importance of obtaining a history from our patients. So this is where we'll ask the patient when their symptoms started, if they have a family history of asthma, how they've been treating their asthma at home, if it's been able to be relieved by their treatments at home, and also if they're surrounded by any environmental triggers that are causing flare-ups. Overall, these are our diagnostic and laboratory treatments for patients with asthma. In this next slide, I will be reviewing the treatment options for patients with asthma based on our textbook, Applied Pathophysiology for the Advanced Practice Nurse. So there are two main classes of drugs that are used in the treatment of asthma, and these include bronchodilators and corticosteroids. First, we will look at short-acting beta-agonist bronchodilators, and an example of this drug is albuterol. So these work by dilating the bronchioles to better help with gas exchange due to asthma causing bronchoconstriction. And so these are what are used as rescue drugs, rescue inhalers during an acute asthma attack and asthma flare-up, and this is what the patients will use first. Next, we have corticosteroids. An example would be prednisone, and these work by reducing inflammation to help with the airway inflammation in asthma patients to improve gas exchange. And so other forms of drugs for long-term management of asthma are going to be our long-acting beta agonist bronchodilators, and then other drugs can include leukotriene modifiers, immunotherapy, and then new drugs such as biologics, which are monoclonal antibodies. But overall, mainly bronchodilators and corticosteroids are used in the treatment of asthma. Next, we'll look at non-pharmacological treatment options, and these include developing an asthma plan with the patient. So this is where you're going to teach the patient about avoiding environmental triggers such as smoke, pollen, dust, keeping their home clean with air filters, using hypoallergenic sheets, and then maintaining proper nutrition, exercising, treating any other comorbidities that the patient has that can cause an asthma flare-up. So overall, these are both the pharmacological and non-pharmacological treatment options for patients with asthma. According to the article Multidimensional Assessment and Interdisciplinary Care to Reduce Asthma Readmission and Safety Net Hospitals, it mentions the importance of a multidisciplinary team, and so this will include providers, nurses, respiratory therapists, as well as patients and their families in order to improve patient outcomes, improve treatment, and provide specialized care for patients with asthma. In this slide, I will be reviewing the patient education and teaching for a patient with asthma. According to our textbook, Applied Pathophysiology for the Advanced Practice Nurse, it mentions to first teach the patient to avoid triggers. So again, these are things such as smoke, dust, pollen, pet dander, and you can teach the patients to use things such as air filters and hypoallergenic sheets. After this, you want to always reiterate a healthy lifestyle, which includes proper nutrition and exercise, and you can teach the patient how to manage comorbidities at home, such as allergic rhinitis and obesity. Another teaching point would be to teach the patient that some medications can cause an asthma flare-up, such as NSAIDs, beta blockers, and aspirin. According to the article Management of Severe Asthma by Pruitt in 2023, it mentions that you can have the patient do a return demonstration of how they've been using their inhaler at home if they're having recurrent exacerbations. Also, lastly, from our textbook, it mentions to always have the patient return to the hospital if they're having any severe symptoms that are not relieved by their medications and treatments at home, because it can be a risk for status asthmaticus, which is life-threatening. Overall, these are the teaching points in patient education for a patient with asthma. Overall, although there is no cure for asthma, its symptoms can be managed through patient education, teaching, and understanding the signs and symptoms, as well as the pathophysiology of this condition.